Ever wonder why a simple doctor's visit costs more than your monthly streaming subscriptions combined? Spoiler alert, it's not because your physician moonlights as a luxury car dealer. Picture yourself sitting in a sterile waiting room, clutching a bill that reads $3,000 for what amounted to 15 minutes and a prescription for antibiotics. You're insured, by the way, supposedly, the safety net that's meant to catch you when medical expenses fall from the sky like anvils in a cartoon. So here's the question that keeps you up at night, right? Between worrying about that weird mole and whether you left the stove on. How did we end up in a system where the people who pay for healthcare don't actually receive it, and the people who provide it can't set their own prices? Welcome to the wonderfully broken world of American health insurance. Let's rewind to the 1940s, when health insurance was basically a cute community project. Hospitals were struggling during the Great Depression, so they invented something called Blue Cross, a prepayment plan where you chip in a few bucks monthly and they cover your hospital stay. Simple, transparent, almost adorable in its innocence. Then came World War II, and suddenly everything changed because of wage freezes. Employers couldn't offer higher salaries to attract workers, so they got creative and started offering health insurance as a benefit instead. The government even made it tax deductible, which seemed like a great idea at the time, kind of like how inviting a vampire into your house seems polite until you realize what you've done. Fast forward a few decades, and that innocent little arrangement metastasized into a trillion-dollar industry. Insurance companies realized they were sitting on a gold mine. They stood between patients and doctors, controlling the flow of money like a medieval toll bridge operator. Only this bridge charges you even when you don't cross it. Here's where it gets deliciously absurd. Insurance companies don't actually want to pay for your healthcare. That's literally against their business model. Their profit comes from collecting premiums and denying claims, which creates a beautiful paradox. The product they sell is the promise to pay for something they're incentivized not to pay for. Now imagine you're running one of these insurance behemoths in the 1980s. Competition is heating up, profits need to grow, and shareholders are getting antsy. What's your brilliant solution? Managed care, a fancy term for we'll decide what medical care you actually need. Thanks very much, despite having zero medical training ourselves. They invented something called the HMO, the Health Maintenance Organization, which sounds responsible until you realize it's just a system where insurance companies pay doctors less for doing less. Suddenly, your physician isn't just treating you, they're navigating a bureaucratic maze of pre-authorizations, referrals, and coverage denials that would make Kafka weep. The insurance companies also pioneered a little trick called utilization review, which is corporate speak for we'll question every single medical decision your doctor makes. Got prescribed an MRI? Better hope the insurance company's algorithm agrees with your doctor's decade of medical school, because spoiler, it probably won't. But wait, there's more. And this is where the real magic happens. Insurance companies started negotiating network rates with hospitals and doctors. Sounds reasonable, right? Except those negotiations turned into something resembling a protection racket. Accept our lowball rates or we'll exclude you from our network, cutting off access to thousands of patients. Here's the kicker that'll really bake your noodle. Those sky-high prices you see on medical bills, they're not real. They're inflated numbers that hospitals invented because insurance companies demand discounts. So hospitals charge $10,000, knowing insurance will negotiate it down to $3,000. And if you're uninsured, well, you're stuck with the fantasy price. This created a bizarre economy where nobody actually knows what anything costs. Your appendectomy might be $15,000 at one hospital, $45,000 at another, and good luck finding out beforehand. It's like shopping at a store where all the price tags are written in invisible ink, and you only find out the cost after you've already bought the item. Meanwhile, insurance companies developed the pre-existing condition exclusion, a policy so cartoonishly evil it feels like it was designed by a villain in a cheap thriller. Had cancer 5 years ago? Sorry, we can't cover your twisted ankle because obviously it's related to your previous malignancy. The 1990s brought us the era of denial management departments. Entire floors of insurance company buildings staffed with people whose job description is literally find reasons to say no. They're not doctors, they're not nurses, but they'll overturn your oncologist's treatment plan based on a flowchart and a profitability spreadsheet. Let's talk about the appeals process, that magical journey where you get to argue with your insurance company about whether you deserve to live. You submit forms, wait weeks, get denied, appeal again, wait more weeks, maybe get approved if you're lucky and persistent enough to outlast their bureaucratic war of attrition. And the pharmaceutical industry jumped into this circus with both feet, setting drug prices that make your eyes water. A vial of insulin costs $6 to produce, but sells for $300 because insurance companies will pay it, pass the cost to you through premiums, and everyone profits except the diabetic who needs it to survive. Insurance companies also invented the deductible on steroids, those $5,000 minimums you have to pay before coverage kicks in. So you're paying premiums monthly for the privilege of paying thousands more before your insurance does anything. It's like paying for a fire department that only shows up after your house is already burned down. Prior authorization became another weapon in the arsenal. Need a surgery? Better wait 3 weeks while we decide if you really need it. Never mind that your surgeon already decided we've got a computer algorithm and a 23-year-old with a bachelor's degree in business administration who'll be reviewing your case. The formulary system is equally spectacular. Insurance companies decide which medications they'll cover based on which pharmaceutical companies gave them the best kickbacks. Your doctor prescribes what works best for you, but your insurance company prescribes what works best for their profit margin. Then came the Affordable Care Act, which tried to fix some of these problems, but couldn't quite overcome the fundamental issue. It still left insurance companies in charge. Pre-existing conditions got covered, which was great, but premiums skyrocketed, deductibles ballooned, and the insurance companies found new creative ways to avoid paying claims. Networks got narrower, meaning fewer doctors and hospitals accept your insurance. Surprise billing became an art form. You go to an in-network hospital, but get treated by an out-of-network anesthesiologist you never met, and suddenly you owe $50,000. How delightful. Insurance companies merged and consolidated, reducing competition and increasing their leverage. Now, 4 companies control nearly half the market, and they all seem to have attended the same seminar on creative claim denial. Competition was supposed to lower prices. Instead, it just created bigger monopolies. The administrative costs are staggering. Nearly 30% of every healthcare dollar goes to paperwork, billing, coding, and fighting with insurance companies. Hospitals employ more billing specialists than nurses in some departments. Doctors spend hours on prior authorizations instead of treating patients. And here's the beautiful irony. Other developed countries figured this out decades ago. They either eliminated private insurance or heavily regulated it, and somehow they managed to cover everyone for half the cost while achieving better health outcomes. But suggesting we learn from them gets you labeled a radical. Meanwhile, medical bankruptcies remain the leading cause of personal bankruptcy in America. People with insurance, mind you, they're not uninsured freeloaders. They're folks who played by the rules, paid their premiums, and still got financially destroyed by a cancer diagnosis or car accident. The system perpetuates because insurance companies spend millions lobbying Congress to keep things exactly as they are. They've convinced half the country that the current disaster is somehow preferable to any alternative, using fear and misinformation like a masterclass in propaganda. So you're left holding that $3,000 bill for antibiotics, wondering how we built a healthcare system that serves everyone except the people who actually need healthcare. The insurance companies engineered this masterpiece over 70 years, brick by bureaucratic brick. Every denied claim, every prior authorization, every out-of-network surprise is a feature, not a bug. The confusion is intentional. The complexity is profitable. Your frustration is priced into their business model. The wildest part? We all keep participating in this theater because the alternative, being uninsured, is even worse. They've created a system so broken that being trapped in it feels like the lesser evil. That's not just clever business, that's artistic level manipulation.